read out and that would actually make us laugh. Hashtag BBC GMS.
Yeah, that's your challenge for this morning. Now, an Aberdeen mum whose life has been shattered by long COVID is travelling to Germany this week for a pioneering treatment which will target tiny blood clots thought to be a core cause of the debilitating condition. There are now an estimated 164,000 people in Scotland with long COVID, according to the latest figures from the Office for National Statistics. The Scottish Government says it's spending £3 million this year to improve care for long COVID patients. Fiona Stalker reports.
I was so incredibly tired. I was sleeping a lot of the time. And then as the weeks progressed, stranger symptoms would arrive, like shortness of breath, lots of problems with my mobility. I came out in rashes everywhere as well.
Kate Stott woke up in March 2020 with a sore throat. 2.5 years later, her life is unrecognisable.
That feeling that you get before you get an operation and you're put under anaesthetic and they say count down from 10, that is what living with long COVID fatigue is like every single day. It just feels like you're sedated.
A former Scottish Businesswoman of the Year, much of the 36-year-old's life is spent on the sofa in pain.
I feel like I've got concussion, and that sounds bizarre to anybody else who hasn't experienced this, but I can do something as little as taking the washing out of the washing machine and I feel like I've hit my head. I'm sick, I'm dizzy, and I have to come and immediately sit down again.
The mum of 3 has been hospitalised numerous times. It took 2 years and thousands of pounds to finally get a diagnosis. Tomorrow, Kate heads to Germany for treatment, which will target these so-called microclots.
When I get to Germany, I will have my blood taken. It will be tested initially for microclots and hyperactive platelets. I will then have a follow-up consultation with the doctor there. What I hope to come home with is prescription drugs that I'll be able to take here, that I'll be able to speak with my GP and my specialist here and try this trial.
Microclots are emerging as a key to unlocking long COVID treatment.
It's an impact on people from a health perspective, from their whole life perspective, from their financial perspective, from their employment perspective. This is something that affects every aspect of their life.
Kevin Deans is a consultant chemical pathologist at NHS Grampian, who's researching how dissolving these tiny clots found in some patients will allow oxygen back into the tissues and organs, effectively rebooting the body.
Because they are these very hard to break down little clots, if we can use medicines to dissolve them, and the question then is, does that allow things to reset? Does that allow the formation to kind of settle down? That could hopefully allow improved oxygen supply, blood supply to the body's organ systems.
Kate is one of an estimated 164,000 people living with long COVID in Scotland. As yet, there are no long COVID clinics here. The Scottish Government told me it's for each NHS board to develop and deliver the best models of care. They say this may involve establishing dedicated services such as long COVID clinics.
Two fellies coming.
The big ones are really coming in nicely.
Give her an apple.
Yes.
I've already eaten an apple yesterday.
But Kate can't wait. She's lost enough of her life already. Her mum Adele says it's been agony to watch.
It's catastrophic. It just affects every party. It's really distressing because you don't know what the future holds. Because it's not like she's been diagnosed with a condition that you know what the outcome's going to be.
Chicken wing, chicken macaroni.
Don't sing the
Chicken macaroni.
For me, the hope would be to get back to normal again and get on with life.
But for Kate, that simple hope is the hardest challenge.
Fiona Stalker reporting there with the story of long COVID sufferer Kate Stott from Aberdeen, who's going to travel to Germany this week for pioneering treatment. Well, one of those on the front line of care here is Dr Claire Taylor, who runs a specialist long COVID clinic at a private hospital in Stirling. It's believed to be the only one of its kind in Scotland. Morning to you, Dr Taylor. Your clinic was only set up a matter of weeks ago. What prompted you?
Hi there. So I did a similar job for a charity 2020, 2021. And when that stopped in January this year, I was inundated with people contacting me, asking me to help them. And as an NHS GP, I can only help the patients in my practice. So it took a bit of time, but I have managed to set one up that gives people an option in Scotland.
What kind of cases are you seeing?
So people are really, really sick, and I think sometimes that doesn't come across when we talk about long COVID. There's people, I do video appointments for people who can't travel. Some people have not been able to brush their teeth for months. They can't stand up. People losing their jobs, they've now got no money coming in, they're having to apply for benefits. People having chest pain, shortness of breath, just about every symptom you could think of, really unpleasant symptoms. And they are getting really desperate now over 2 years in.
And is there no help for them elsewhere within the NHS, or is it just not available to them in the area where they live? Or why do they need to travel to see you specifically?
So they don't have to, but if they are struggling in Scotland, the model is that the long COVID clinics have physiotherapists, occupational therapists who are fantastic, managing people with long COVID. There isn't a doctor. Across the UK, it varies, and the model is that existing specialists can manage the different organ systems like heart problems or lung problems. The issue we have is the waiting lists are now so long, and actually not all of the specialists are clued up on long COVID itself. So they want an overview by somebody who has, been involved from the start in trying to treat this disease and has got the finger on the pulse of everything coming through. Is there actually a definition of long COVID now? So long COVID is a constellation of symptoms, and it varies who defines it. But if we go by the ONS study in the UK, it's anything after 4 weeks of having COVID. Some will say 12 weeks, but it's certainly a constellation of various symptoms that affect day-to-day functioning after COVID.
But in terms of the symptoms that people might be experiencing, is there a definitive list, or are you still seeing new ones come forward?
There isn't a definitive list, but we think around 40% have postural orthostatic tachycardia syndrome.
Tell me what that is.
Yeah, there's also known as POTS, and what happens is the control of the heart rate is not working properly, and it causes people's heart rates to soar when they try to do simple things. So if they say they get up to make a cup of coffee, their heart rate, instead of being 60 beats a minute, is 180 beats a minute, and it's almost impossible to function normally while your heart rate is doing that. So we think around 40% have that, and then we don't know how many have something called mast cell activation syndrome, but these little mast cells in your blood respond to infection, and they release lots of things like histamine and give you other symptoms like brain fog and headaches and abdominal pain and rashes. So we know a bit about what is going on. What we don't know is what is still causing it.
We heard there from Kate Stott from Aberdeen, who's travelling to Germany now for this treatment, which she hopes will treat these tiny blood clots. What do we know about that?
So we know that when we look at controls, who are people without long COVID, and we look at people with long COVID, that everyone with long COVID has these microclots, but we've also seen them in things like diabetes and ME. So we're not, quite sure how specific they are, but everyone has them who's got long COVID so far, and that's about 400 that have been to Germany, we think. And they tie in with the mast cell activation and the POTS. We don't know what. Are they downstream from the microclots? But certainly the theory is that they block up the capillaries. The capillaries are the really small blood vessels, and they're very thin, and they're easily affected because of that. And it's not just adults that have went to Germany. Children have been to Germany as well.
Could we be offering it in the NHS here?
What we need to do in the NHS is we need to change the rules that opened up rapid trials for acute COVID. So back in 2020, the trials that showed steroid, for example, when you were in ICU, reduced your risk of death by a third. We need to open that back up and allow rapid trials. We need something to show that when you give this therapy, that it's better than something else. We need to do that first.
Claire, we must leave it there. Thank you very much indeed, Dr. Claire Taylor.
On digital radio,
FM,
your smart speaker,
and on BBC Sounds.
BBC Radio Scotland.
Morning, the time now, 8 o'clock.